Well, both the incidence and prevalence of hypertrophic cardiomyopathy in Olmsted County have risen significantly since the index study that we have reappraised from around 3 decades ago. I'm Dr. Shahid Karim. I'm a cardiologist currently taking my PhD at Mayo Clinic, and my co-author, who unfortunately couldn't be present, is Dr. Anwar Chahal, another cardiologist, electrophysiologist working at Wellspan Health, and he's also a former PhD graduate from Mayo Clinic. So the title is Reevaluating the Incidence and Prevalence of Clinical Hypertrophic Cardiomyopathy, an epidemiological study of Olmsted County, Minnesota, in Mayo Clinic Proceedings. In terms of funding, the study was supported by a philanthropic grant from the Paul and Ruby Tsai Foundation, an NIH grant, and a grant from the Sleep Number Corporation. So we found the incidence and prevalence of hypertrophic cardiomyopathy in Olmsted County has risen near enough each decade from the index study that we've reappraised. We've seen that the prevalence of hypertrophic cardiomyopathy we found in our study to be around 1 in 1,100, which is lower than some of the contemporary studies, and there are a few reasons potentially for that. And the third main finding is that the risk of mortality is higher in hypertrophic cardiomyopathy compared to the general public, but we've seen that that gap has narrowed since the index study. It challenges what we know about the prevalence of hypertrophic cardiomyopathy. We talk about it in the manuscript itself, but this study differs from some of the other contemporary studies in the sense of it's not sort of registry-based, it's not imaging-based necessarily. This is based on diagnoses of clinical hypertrophic cardiomyopathy. I think it adds to what we know about the prevalence of hypertrophic cardiomyopathy. We talk about some contemporary studies of the same in the manuscript and discuss how some studies include subclinical disease or are imaging-based, for example. In this study, the difference here is that this is based in a very fixed geographical location with a relatively fixed population, let's say, and it's helped by the fact that we have this Rochester Epidemiology Project, this very carefully set up program of the medical records linkage system that allows near enough complete coverage of the residents of Olmsted County and gives us a very accurate picture of the number of people diagnosed with clinical hypertrophic cardiomyopathy within the county. We were surprised to see that males and females were affected equally. Prior studies have suggested that males have a higher prevalence of hypertrophic cardiomyopathy and that females perhaps present with more advanced disease. Well, our next intention is to use the database to try and ascertain some of the key determinants of mortality and morbidity in hypertrophic cardiomyopathy, particularly things like atrial fibrillation, for example, which they're at a higher risk of developing and is poorly tolerated in hypertrophic cardiomyopathy. And our group is also using the database to study other cardiomyopathies. And if you're interested in this topic, please do read our article, which is being published in Mayo Clinic Proceedings in March.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.